A lot of organizations have recognized the importance of helping clinicians, and I use that word broadly to include everyone who works in healthcare, helping the team care for patients, helping clinicians deal with stress. It often helps to speak with someone who's already gone through something like that, both to share with them that it's entirely normal, the feelings they're going through, as well as to explain, in their experience, there's actually light at the end of the tunnel and things get better. The Betsy Lehman Center recognized that not all healthcare organizations provide peer support to their clinicians and developed this wonderful program where they've asked for a number of volunteers from throughout the state, all different kinds of backgrounds. My background is a physician, as a radiologist, but there are people who are in healthcare in different backgrounds, nursing, administration, et cetera. The training that I received in the peer support program really involves the ability to listen deeply, to hear what other people are saying, not necessarily try to fix their problem, but to empathize and to share that this is normal, to normalize and to help people get through it. As a physician, it's sad but true that we often lose patients. Nobody lives forever. When you're in medicine long enough, you're associated with an adverse outcome or an unexpected outcome that you wish had been different. And in retrospect, you think about it and it's stressful. The healthcare workforce, as I mentioned, over the last decade has really been under increasing stress as what we do becomes more complex. The tools we are given to do our jobs become more complex. And then, of course, with COVID, in the early days, there was risk going to work that you may contract an illness and die or bring an illness back to a loved one who's more vulnerable and let them die. These stresses were enormous. And the unwritten curriculum when I was going through medical school was don't admit weakness, don't ask for help. When you're swimming with sharks, you don't make waves. And if you're bitten, you don't bleed. You keep everything to yourself. And that really was the way I was trained. And I think most physicians my generation would say that was the case. And it's really the wrong way for people to become compassionate healthcare providers. Burnout and stress and suffering because of a life adverse outcome, whether it's work-related or person-related, these are not weaknesses. These are normal parts of being a human being, and speaking with someone else about it can actually help. And that's what the Betsy Lehman program is all about and why I'm part of it.